Hi, everyone. Well, first of all, Happy New Year. I wanted to use this video, this opportunity to discuss the field of psychiatry and also to address some possible misconceptions in psychiatry and also to, in a sense, contrast psychiatry and psychology. Well, first question, what is psychiatry? Well, psychiatry, I would say, is a medical specialty that deals with the diagnosis and treatment of mental illness that really pertains to cognitive, emotional, and behavioral issues. People sometimes ask me what the difference is between psychiatry and psychology. Well, the very first thing is that psychiatrists usually have to go to medical school to practice, and psychologists go to graduate school. Psychiatry, in a sense, is a little bit more restricted in its scope because, like I mentioned, it deals mostly with mental illness. On the other hand, psychology, in its widest sense, encompasses both normal and abnormal human behavior. And so it has a broader scope, if you will. But practically, one of the more practical differences between psychiatrists and psychologists is that in the clinical setting, a psychiatrist is able to prescribe medications, and generally, psychologists do not, at least not without additional specialized training. That's one of the differences, or is a question I sometimes get. I want to just address some basic misconceptions, or in a sense, you might say stigma. And these misconceptions, in a sense, the two of them I want to talk about, and they are kind of like on opposite ends of the spectrum. So on the one hand, psychiatry, because of its very nature, historically, we haven't really understood a whole lot about the cause of mental illness. And people may have, in a sense, attributed, at least to a significant degree, the cause of mental illness to a failure in willpower, or maybe even attributed some mental illness to supernatural causes, at least predominantly to supernatural causes. And there might historically have been less of an emphasis on, you might say, the biological aspects. But at least in the past few years, past few decades, we've learned more about the neuroscience, the brain, and some of the more biological bases and foundations of mental illness. Hence, we have medications that actually affects biological aspects of the nervous system and helps treat some of the mental disorders that we know of. And if you're following my channel, I have neuroscience videos in which we try to talk about the neuroscientific foundations of psychopathology. But there's a risk, and this leads me to the other stigma. There's a danger of going too far in that other direction, where we now think of the human being as purely materialistic. And I think this is not a complete view. In general, we think of a human being, at least in our field of psychiatry and even psychologists, having multiple domains. There is a biological aspect, there is a social aspect, there's a psychological aspect. In principle, a psychiatrist attends to all these aspects of a person. But I think actually that it's even deeper than that. I think that there's an aspect of a human being, there's a domain that transcends the biological, transcends the social and the psychological. I think it's legitimate to talk about a spiritual dimension to man. I'm not alone in this thinking. You have psychologists such as Viktor Frankl, who wrote the great book Man's Search for Meaning, and pioneered logotherapy that has to do with meaning as a main drive of life. I'm not an expert in this therapeutic technique, and obviously there are historical traditions that has viewed a human being as more complex than just biology or psychology. And I don't think the ancient traditions are wrong, or they might get some things wrong, but I think there's a lot of wisdom and truth to their view of the human being. For instance, if you go all the way back to ancient Greece and you look at Aristotle's view of a human being, he believed, or at least he wrote, and it wasn't just a belief, it was based upon his philosophical treatment of reality, of which man is an example of a living thing. But in his philosophical treatment, he concluded or deduced that we have immaterial aspects, our soul, he said. And for him, the immaterial aspects were our reason and will that are non-reducible to matter, that transcends the material. It has a very, very, very complex, very rich, very sophisticated view of the human being. And I think there's a lot of wisdom to be found from that. Of course, millennia afterwards, Aquinas would take some of those ideas and use that to inform his faith tradition. But I think there's a lot of wisdom to thinking of the human being as more than just biology. And part of the reason why I say that is from my clinical practice and from just understanding how society is evolving, if you will. It's become very clear to me that a lot of people are missing something. It seems that medication might not necessarily fulfill or feel, nor even just mere therapy. You might say it's meaning. And I think meaning is a very important thing. It's a very rich thing. And I think there's something about meaning that potentially transcends just the material of the biological world. But I just wanted to give this very quick, brief overview of what psychiatry is. It tends to, currently we think of it as being more biological, but I think the human being, that is the subject of psychiatry, an object of psychiatry, in a sense, is much more interesting and much more complex than just that. But even with that kind of appreciation, very important to appreciate the complex neuroscience, the complex neurochemistry, complex brain networks, and all of that knowledge and data we now have that enriches our understanding of various mental illness and guides the development of our various treatments. That was quite a bit. That was quite a lot. I want to pause here, and I invite your comments. Feel free to like this video and subscribe. I will try to talk more about this very, very exciting, eternally fascinating field of psychiatry, my great passion. All right, well, you guys have a great one, and I wish you phenomenal rest of your year.